Good morning, everyone. So welcome. My name is Darshan Mehta. I'm the Associate Director of Education for the Osher Center for Integrative Medicine here at Brigham Women's Hospital and Harvard Medical School, and Medical Director at the Benson Henry Institute for MindBody Medicine. So we're going to go ahead and get started, but before just a few housekeeping announcements. As everyone knows, we hold these grand rounds on the first Tuesday of every month, and next month we'll have our very own Dr. Helen Langevin presenting a research seminar on stretching, connective tissue inflammation, and cancer. And so that'll be our grand rounds on June. And then in July, we have Dr. Paolo Cassano, who will be presenting a case on photobiomodulation. And so stay tuned. And then again in a couple of other, just as it relates to today's presentation, we, along with several others, are co-hosting a symposium on Ayurveda and cancer, which will be held at the Martin Conference Center from June 22nd to June 24th, and those details are on the table outside. And then after grand rounds, please do join us for a coffee hour / continuing dialogue, and that'll be just right outside across the hall. So with that, I'm really pleased to introduce Marni Chanoff, who practices integrative psychiatry and is an Ayurveda consultant. She serves as Director of Wellness of the On-Track program for her first episode psychosis at McLean Hospital and is a lecturer at Harvard Medical School. She's a graduate of the MGH McLean residency training program. And discussant will be Dr. Rakesh Karmacharya, who's a native of Kathmandu, Nepal, and is currently an assistant professor of psychiatry at Harvard Medical School, and is also he's the medical director of the On-Track program at McLean Hospital as well. So, Marni.
Good morning, everybody. Thank you very much, Darshan. I have this. Can you guys hear me okay? It's for the recording. Can you hear me now? If I project a little bit more? Yes? Okay. Good morning. Thank you very much for the invitation to come. We're thrilled to be able to present our work to the community this morning. We have a lovely morning planned. We'll start with a presentation on Ayurveda and integrative psychiatry. We'll then move to a patient narrative, a story of recovery told in our patient's own words. We'll then have a discussion. Dr. Karmacharya and I will discuss both Eastern and Western approaches to psychiatry. We'll have a piece of music played. As you can see, we're set up. It's going to be wonderful. And then we'll have plenty of time for questions and answers. So I hope you enjoy the morning. We're going to start off on a journey. We've started in southern India. We're stopping off at the island of Kos in Greece to pick up Hippocrates, the father of medicine. And of course, we're landing here together at Brigham and Women's. We're celebrating this morning the coming together of two worlds, the Eastern and Western, bridging the best of both of these approaches for a rich, robust, comprehensive approach to psychiatric recovery. I'm going to introduce you to three concepts. These are three aspects of mental health care that I feel are very important to understand. We're just going to go through them quickly this morning. I'm happy to answer questions later. This is an integrative psychiatry model. This is based on the psychosocial, biopsychosocial recovery to psychiatric disorders. This is something that we're trained in as Western clinicians to understand a holistic model, a way of approaching all aspects of a person's life. We're going to add to it an Eastern perspective. We're going to add some history. We're going to add some perspectives that you may not have heard of before that really complement the Western approach. So we're going to start with the MindBody Health. And I've been training in Ayurveda for the last several years. I've trained as an Ayurvedic health consultant a health counselor. I'm trained in both diet and lifestyle practices to address the imbalances of the mind and body. So what we're going to do today is look at this from the diet and lifestyle perspective. We're going to understand that there's always a way back to health from the view of Ayurveda. There's this concept called swastha, to be situated in oneself, that we already have the innate wisdom to heal ourselves. We need to figure out what it is that the body needs to do what it does best. We need to set the conditions for the body to heal itself, so the body can then heal, move on, recover. And it's up to us to pay close attention to what it is that the body is calling for. Broad strokes, Ayurveda is a 5,000-year-old science. It comes from India. It is a complete system of health. It's thought to be the oldest healthcare system in the world. It approaches body, mind, and spirit. It's an elemental science, much like other traditional forms of medicine. There are 3 humors or life forces that we talk about. In Ayurvedic terms, they're called doshas. Some of you may have heard that before. It's not important. We're going to focus on a very specific life force or dosha today. We'll get into that in a minute. What's really interesting is that in Ayurveda, the belief is that home starts in the GI tract, which is so different than in our Western understanding. Although in recent years, we're starting to discover that there is this very intricate connection between the gut and the brain. The gut-brain axis is becoming something that's much better understood. Ayurveda has always believed that the home of health is in the gut. So therefore, nutrition is very, very important. Ayurveda is a preventative medicine, so it looks at the precursors to disease. So in the first 3 stages of disease, according to Ayurveda, the disease process has not manifested yet, and you have the ability to tune in very carefully to these earliest signs of imbalance and use diet and lifestyle practices to reverse them. This is the idea of swastha. There's always a way back to health. You have to just tune in carefully and have the proper tools to be able to address the imbalances. So this morning we're going to look at Vata. Vata, as I mentioned earlier, it's a life force. It's called a dosha. But what's most important for you to know is that it's an energy that governs the nervous system, digestion, respiration, and all mental activities. Vata is very important as a psychiatrist because it's sort of the target when I'm talking with patients about their own stress level, anxiety level. Vata imbalances are very common. We probably experience them multiple times a day. For some of us, multiple times a week. It's when you're running around, there's a frenetic energy, you feel like your thoughts are scattered. And it's those times where if you have the tools to identify them and treat them, that you can bring yourself back into balance and move on and feel much better. So if you don't treat these imbalances, these can lead to stress, anxiety disorders, and in extreme cases, bipolar disorders. Vata derangement. This is basically a term that we use to talk about this real imbalance of the Vata. And so I think in our terms, we can think of it as chronic stress. And as most of you are very well aware, we are very well equipped to deal with acute stress. We've got the internal resources to deal with acute stress. It's chronic stress that causes problems. And chronic stress can manifest in symptoms in the body, the mind, emotions, and behavior. If you look at these lists, you can see some of you may identify with at least a couple of them, maybe much more than a couple. But these are very common in our lifestyle today. And you can see that it's a whole body disorder. Look at this chronic stress. Not only are we dealing with our own stress, but as a society, we're dealing with huge amounts of anxiety. This was a Times article from last year. Anxiety is starting to seem like a sociological condition, a shared cultural experience that feeds on alarmist CNN graphics and metastasizes through social media. 38% of girls ages 13 through 17 and 26% of boys have an anxiety disorder. And on college mental health, college campuses, anxiety is the biggest mental health concern over depression. And now we're understanding that in addition to stress and anxiety, in illnesses like bipolar disorder and other psychiatric disorders, we understand that there's a large amount of inflammation that's occurring, both in acute states and chronic states. So it's not just a mental condition, it's a whole body condition, and it's showing up as inflammation in the body. And as many of you are aware, inflammation can go on to become chronic medical conditions if not treated. Not only is there inflammation from the disorder itself, but oftentimes when people are struggling with these mental health conditions, it can lead to a tremendous amount of loneliness and isolation. There's stigma, there's marginalization. People are dealing with their psychiatric conditions. They have to take time out of school. They have to take time out of work. Their peers move on. They're oftentimes hospitalized, maybe once, twice, 3 or 4 times. Their lives become off track. And this leads to a tremendous amount of shame. And oftentimes people want to hide out when they're feeling ashamed of where they are and what they're dealing with, which actually leads to loneliness and isolation. There's a sociologist and clinical psychologist, John Chanoff at University of Chicago, who studies loneliness and isolation. And he found that socially isolated people suffer higher mortality rates, cancer rates, infection, and heart disease. So this is another example of how people with psychiatric disorders are dealing with whole body, mind-body issues. In addition, there is something known as the double epidemic. This is not just the fact that we're dealing with mental illness, that we're also dealing with weight gain and obesity, that there's a real correlation between obesity and psychiatric illness. We see this in depression. We see this in psychotic disorders. We see this in stress. Stress leads to biochemical changes that trigger cravings, which can lead to obesity. And most importantly, the very medications we use to help our patients the most, the ones that can actually save lives. These are the antipsychotics, the best medications we have for severe conditions, often can lead to 10 to 20 to 30 to 40 pounds of weight gain. And so going back to that island of Kos in Greece with Hippocrates, as physicians, we take the Hippocratic Oath, we shall do no harm. It's very, very hard as a psychiatrist to be prescribing these medications that I know could very well save a patient's life and might also lead to 20 to 30 pounds of weight gain. It's a real dilemma as psychiatrists. And I feel as a psychiatrist, it's my duty to not just prescribe these medications, but to also offer practices and tools to offset the side effects, to give people the tools to help them manage the side effects, to help mitigate the risks of chronic illness and everything that comes with it. So I've studied Ayurveda, and now I'm very well aware of the power of these practices, both in my personal life and in my professional practice. I actually had the opportunity to go to India last year, and I was treated at an Ayurvedic center for my own wellness. And so I'm very well aware of how powerful these are if you're treated in the right setting. It's, as we mentioned before, it's a complete science. So all of these tools within Ayurveda work together. They complement each other. There's a synergy between them. I focused on just a few this morning just to give you a taste. We use herbs. This one I've mentioned here is ashwagandha. It's very commonly used in Ayurveda. It's an adaptogen. It's an anti-stress medication. It's used for resilience, for stamina. It combats stress, anxiety. It's studied and seen to improve cognitive issues in bipolar disorder, OCD, addiction, and even offset the risk of tardive dyskinesia, which is a common side effect with antipsychotics. Ayurvedic massage. There's many oils that are used, medicinal oils, or oils infused with herbs, depending on what kind of condition is being treated. And one study showed that the Ayurvedic head massage increases parasympathetic activity. That's the rest and digest. That's the relaxation response that Dr. Herbert Benson has taught us about. And it's also known to alleviate anxiety. We also use diet. So we know that in an Ayurvedic diet, it's based on principles very similar to the Mediterranean diet. There's a lot of data looking at the Mediterranean diet and its impact on both mind and body health. Now there's a new burgeoning field actually looking at the gut bacteria and its relationship to mental health. And it's a very powerful one. Serotonin in the gut circulates through the entire system. There's a relationship between what you put in your body, the tissues that manifest, and then the mental health that comes later. So we're starting to really understand this. There was a study that recently came out of Australia looking at the Mediterranean diet for depression. And they found people who are eating a Mediterranean diet, which is based in fruits, vegetables. It's a plant-forward diet, high fiber, whole grains, whole foods, that this kind of diet actually promotes both physical and mental wellness. In addition to these modalities, we use yoga, which is the sister science to Ayurveda, breathing techniques, meditation, and music, which we'll get to enjoy in a little bit. In addition to mind-body health, we are actually looking at meaning and purpose. And this brings in some of the Eastern philosophies that I've been studying along with Ayurveda. This is a concept called Dharma. And in Stephen Cope's book, he refers to Dharma as our sacred duty, that every one of us was put on this planet to do something very unique and very special. And it's up to us to help people understand that and understand what their unique vocation actually is. And in order to do this, I fully believe that first you need to start with the mind-body health. You need to have that stamina. You need to have that resilience. You need to have the strength. You need to have the clarity of mind. And once you have the clarity of mind, you can tune in very carefully. You can really understand what your inner true calling is, to really be discerning, to understand what is most important to me, what are my passions, what makes me feel most alive, to really come to know what your real true calling is, what your Dharma is. And it turns out that when you have real meaning and purpose in your life, this actually helps with social anxiety. This is a study that showed people with social anxiety reported greater obstacles and failures in life and less motivation for their purpose. Self-esteem, meaning in life, and greater positive emotions increased when they devoted effort and made progress towards their purpose in life. So when people figure out what it is that's most important to them, they become more resilient. They become more confident in themselves. And that's really important, especially when you're recovering from a mental health issue or a psychotic episode. You need to feel good about yourself again. You need to have direction. You need to have an understanding of what it is that you can still do, what it is that you're going to wake up in the morning and feel good about. What are your talents? What are your strengths? And how can you bring them out into the world? And then, of course, you take this towards the community. And I worked on a psychosocial recovery team for many years. We understand the importance of integrating in the community. We understand the importance of keeping people out of the hospitals, out of treatment centers, and helping them integrate into the community. Help them find their groups. Help them find their sanghas, the supportive group to help nourish a person's values, a person's goals, help them move forward in the community, help them find their special place in the community, even if they have a diagnosis. And this is the importance of Sangha or social connectedness. Going back to Kachapo's work, we understand that when you're lonely and isolated, you suffer both mentally and physically, and social connectedness is actually a very powerful piece of this recovery story. And it turns out that meaning and social connectedness are related. A sense of meaning drives social behaviors and decisions like joining organizations, getting and staying married. And when the feeling of belonging to a community, when you feel like you belong to a community, you actually have an increased meaning in life. So there's a bi-directional relationship between meaning and connectedness. So we've covered mind-body health, we've covered meaning and purpose or dharma, and we've covered the importance of sangha or social connectedness. To illustrate this, to bring this to life, we're going to now move towards understanding this through a patient's perspective. I have the great honor of making an introduction. I will allow John, can you still hear me? Yeah. I will allow John to tell his own story of recovery with you. I will simply highlight a few themes from our work together. Many of these themes are known to make psychotherapy successful. John's treatment had two essential ingredients of recovery: guts and grit. When Dr. Rakesh Karmacharya referred John to me for psychotherapy in early 2011, we started with twice-weekly sessions. Even at that early phase, John was ready to let go of the parts of his life that were no longer serving him, and he was ready to rebuild. John had tremendous support from his family, and along with that, he tuned in and listened very carefully to his inner wisdom. With tremendous courage and humility, he went back to the basics: his values, family, the family home, and the piano. And through this process, along with the right medicine, monitored by a colleague of ours, Dr. Ann Shin, he rebuilt relationships with himself first and with his family and friends. He surrendered to the process of change. He always took the lead. And this was slow medicine. And he was patient, and he was meticulous. As for my part, I fully believe in him. And I fully believe in the power of this medicine, this integrative treatment approach infused with Ayurveda. It's deeply rooted in our therapeutic relationship, which is most important. In addition to mutual respect, trust, and giving the work everything we both had, we've been curious and playful. I'd learned something new in my Ayurvedic studies, and he'd actually try it out. He'd come back to tell me all about it, and he'd enrich my understanding of whatever it was. We'd tweak and tweak and tweak like two scientists in a lab. And over the years, the experiments became honed daily practices, oftentimes for us both. What started out as an intensive twice-weekly therapy is now a quarterly touchpoint session with medication monitoring, studded with opportunities to see him perform, and recently partnering in preparing for this morning's presentation. This has been an incredibly rich journey. John is truly one of the most extraordinary people I know. He also represents the wonderfully talented, brilliant, and compassionate people with whom I've been honored to partner in their pursuit of health, authentic living, and connectedness. It is with great pleasure that I welcome John to share his recovery story.
Good morning, everyone. I'm truly honored to speak before all of you, and I hope sharing part of my life journey will encourage, if not embolden, more caregivers to deliver a more holistic, integrative approach when treating patients. My first psychotic episode was in 2005, where I was hospitalized and diagnosed bipolar disorder 1 at McLean Hospital. In 2008, 2009, 2010, and 2011, I experienced more episodes which required hospitalizations. Throughout all of this, law school only exacerbated my symptoms, so I had to let it go 2/3 of the way through, despite being championed and featured in a nationwide law magazine. So in 2011, I dropped off the radar from friends, from school, from everyone but my family, and entered the darkest of depressions. I lost hope in ever being healthy, happy, and a productive member of society. It was only until 2011 when the presenting speakers here today decided I needed the right balance of lithium, Lamictal, and a lot of therapy. Various combinations of prescription drugs and therapy did not help in the past. It was time for a fresh approach. I've been asymptomatic since 2011, no mania, depression, or psychosis. I do not know how pills alone without any integrative therapy treatment could have carried me through recovery. My therapy sessions delved into creating a healthy, soothing space within and around me. Dr. Chanoff and I discussed mindfulness, breathing techniques, meditation, and more. We shared book recommendations, favorite music, searching and navigating potential positive lifestyle changes. I began changing my living environment into a healthier space, repairing the family home where I grew up. It felt good to be productive, learning new do-it-yourself projects, fixing old doors, retiling floors. The experience was therapeutically soothing and very much appreciated. I found community participating in a support group with the Depression Bipolar Support Alliance, where I eventually led group sessions as a trained facilitator. Mindful awareness exercises led me to a beautiful, healthy relationship with myself, which in turn opened the door to embracing the beauty in others, and particularly in another person, my wife Mary. We got married in 2016 and found ourselves a lovely home to call our own. Without practicing self-awareness techniques, I would not have found my purpose in life. It is my calling to play piano and share my musical talent with others. Over the past 5 years, I've served as piano faculty and lecturer at several colleges, universities, and piano academies. How blessed am I to have unfurled my dream, to even have my name on a door, and to help others just beginning to set sail. Not a day goes by where I'm not filled with humble docility and gratitude. In 2012, I combined my love for music and social justice, founding and incorporating a performing arts nonprofit charity. As a growing chamber music ensemble organization, we bring professional live classical music to Boston area hospitals. We believe music is vital to healing the body, mind, and soul, and that everyone deserves orchestra seats. The physicians presenting here today have attended some of my concerts. We motivate each other. It is the working template for how I interact with family, coworkers, and students. For I often think of my students as my peers. I don't talk to them, I engage with them. Lastly, I just want to mention my diet, exercise, and medication. I eat more seafood and less red meat. Yogi herbal teas center me. I gave up alcohol and refrain as best I can from fast food. I go for walks and occasional jogs. I've never smoked cigarettes or used recreational drugs or abused prescription drugs. I take lithium and Lamictal every night, and just as medication is essential in my wellness plan, I actively practice meditation and mindfulness every day. Thank you so much.
So now we're going to have a discussion here. I have a couple of slides that I just want to start us off with. This is Dr. Rakesh Karmacharya. Rakesh and I have go back to our first year of psychiatry residency in 2003. We've been leading groups together for many years since. We lead our wellness group at McLean Hospital together, where we're bringing in these integrative practices into the lives of people who are still recovering from their first episodes of bipolar disorder and schizophrenia. We have a lot of fun together. And we're going to revisit these three concepts: mind-body health, meaning and purpose, and social connectedness. Just a couple of notes. I just want you to know that Ayurveda is actually being practiced here in the U.S., and there's different ways to practice Ayurveda depending on your level of training. So I'm going to outline them very briefly just so you get a sense of what's happening here in the U.S. There's actually an organization called the National Ayurvedic Medical Association. We happen to have the executive director here with us this afternoon. Hi, Hillary. I'm so glad you're here. Hillary was the dean of Kripalu Ayurvedic School She gave an amazing lecture on the intro to Ayurveda. This was many years ago. I came to her lecture. I followed her to her office that afternoon and said, "Can I start like now?" And enrolled in 2 or 3 weeks later. So wonderful to have you here. So Hillary and Nama, they're moving this field forward. I am trained as an Ayurvedic health counselor. I have 650 hours of training. Next would be an Ayurvedic practitioner who, in addition to diet and lifestyle, they're also trained in pathology and disease management. And then there are Ayurvedic doctors who are well-versed in all branches of Ayurveda. There happens to be 8 branches of Ayurveda, research, and they do an extensive internship, 3,000 to 4,500 hours. Physicians who are trained in India, known as Vaidya's, Ayurvedic doctors, they cannot practice Indian medicine here. They can't practice Ayurveda, but they can be educators. So that there's a movement to allow more and more of the Ayurvedic medicine to be practiced here. But Hillary is moving this forward along with Nama. And then just also to note that there's many Ayurvedic practices that are very powerful practices on detoxification, internal procedures that are mostly used in India. Some of them I think can be used in the US, mostly they're used in India, and there are some laws that actually make it illegal to practice some of them here. But I think that this is a field that's moving forward quickly. And then future directions, expanding Ayurveda, and I'd love to hear Rakesh's thoughts on this too. Rakesh has been a champion of Ayurveda along with me over the years. He's another, as I learn things, I come back and tell him all about it, and he's totally gung-ho in bringing them into our practice. So I think we need more and more champions of Ayurveda, and I think coming from the Ayurveda world, in addition to the Western medicine world, I think is the way to go. So the more we can bring this to Harvard and other institutions and introduce these ideas, I think the more people will have an understanding and understand the richness. We also need to further research in nutritional psychiatry and the microbiome. We need a lot of funding for this. Champions of Ayurveda, champions of nutrition can do this. And we need to partner with multidisciplinary approaches. And then lastly, we need to create models of wellness programs embedded within psychiatry programs. I've done this with my colleagues at Ellenhorn, the psychiatric recovery organization I worked for. Rakesh and I are now doing this at McLean. So it's happening, and I think the more we can do this, the more the field will move forward. And now I will join you. I want to hear all of your thoughts about everything.
So I guess I have the dubious distinction of having grown up with Ayurveda all around me and knowing very little about it. So it took the later years for me to learn these things more systematically from Marni. So I kind of wanted to give you a flavor of how psychiatric care actually happens in real practice. John's story is wonderful, but it is not the norm. Oftentimes people have their first psychotic episodes in the early formative stages of their lives, in the late teens, in early 20s, and it's a frightening experience. You go to the emergency room, you have hallucinations, you have delusions, in this chaotic place, then you get admitted to a psychiatric hospital in a locked unit, and then there's intense pressure from the insurance companies, decrease length of stay, so they sort of try to medicate you as much as possible, get in a regimen, and ship you out, and get transferred to the community in a clinic. And so usually we would have a psychiatrist who takes care of you. Your job is, he's the pill pusher, right? He's going to take care of your medications. It's, your 15-minute visits. And for those who are fortunate enough, they'll have a therapist as well, who is someone else in a different setting. And with, not as much interaction between the psychiatrist and the therapist. And, in many instances, that's the best we do. And for many, even that's not available. So even when we think about places like, McLean, and on the other places here, we have a very fragmented approach to care. The psychiatrist looks at, okay, what are your symptoms? What are the pills we're going to give? And a strong dichotomy of the mind and the body. We only deal with the mind. What's happening? What's your mood? Are you having any voices? And to the extent that we look at the body, it's mostly in the context of, are you having any side effects from the medications? Are you having any weight gain? Are you any constipation? Okay, and then in that case, okay, I'll give you another drug to kind of counteract that one. Or, send you to the primary care who's going to take care of the cholesterol that has gone up. So I think what we're trying to bring forth with all the things that Marni is learning from Ayurveda is how do you actually get that a little bit more together, even in our interactions with the patients, not only asking about the mind, but really trying to get a sense of what is happening in the body and how is that the complex interaction, the mind, the body in a more holistic sense. And again, the other part that Marni sort of touched on a little bit that she didn't go in a whole lot about is that in some ways the doshas in Ayurveda, which is a more holistic sense of your temperament, your body, not only in the sense of your mind, but also in the mind and body, and how you can use that as a way of tailoring the treatments themselves. Right now, for most patients, when they come in, if you have mania, you're going to get a lithium. If you have, this, you get an antipsychotic. But even among the repertoire of the pharmacopoeia we have, I think there's subtleties between the different medications. And I think that's where we can be more cognizant of what is it that each patient will react differently to a certain medication. Each patient's experience is different in terms of the episodes that they go through, the kind of impact it has on the meaning in their lives. And some are more receptive to medications, others are not. And how do you sort of incorporate that, understand that, and really use that in helping them recover? As psychiatrists, as therapists, I see our roles as only as guides, right? I think it's really the patients who take the lead, and we guide them to the extent that we can. And the other part Marni touched on also was the idea of diet. And I'll think of diet as, okay, you're gaining weight, go on the fruit and vegetables, but more than just thinking of it as your physical health, also thinking about food and mood in some ways, where the effects of how what you eat interacts with how you feel, interacts with what you're taking for medications, and how that is different for each person. And I think bringing some of the concepts together, again, I really was, my primary role is still a pill pusher, right? So I had to bring Marni in and say, Marni, we have the, first episode program with these young people, in the, early years, in the, young college students who are going through all this, and we really need to kind of have a way of trying to do this more holistically, trying to look at it not as just, okay, what is the right medication, and, are you going to therapy every week? And this is in the context that Marni joined us at McLean as the director of wellness, and so we are starting these groups where, it's really focusing on the non-medical, in some way even non-therapy kind of aspects. We're looking at issues like, okay, food and, sort of meditation and, yoga. And so I think trying to bring that both in as a collaborative approach with the patient. What is it that is affecting them in their life? What is it that they would like help with? What is it that they would want to learn? And even sort of, Marni is now starting to think about having even cooking classes, as a way of having this engaging interactions that focus not only on the mind and the symptoms, but also just more on the overall person.
So one question for you. So, yeah, sure. Is that okay? So as a clinician and scientist, researcher, Rakesh does a lot of even basic science research. There's this dilemma that we have that many of us who practice these integrative modalities in our own life and promote them, know them to be very, very powerful just through direct experience. And of course, we're starting to move forward in terms of research, validating some of these age-old concepts and this age-old wisdom. but there's a lot of room to grow, and we don't have the evidence base that many clinicians feel is necessary to really, push this forward right now. And so as a researcher clinician, what are some of your thoughts about that? How do you show that this is very powerful while we're validating it with science and in our modern techniques?
I think one of the things that happen is we really see a lot of growth in things like Ayurveda, yoga, in complementary medicine in the real world. And it is very divorced from actually what happens in clinical medicine. I think there is very little interaction between clinicians and the complementary practitioners. And oftentimes these are things that are done outside of your traditional healthcare settings. Many of those things are not covered by insurance. And it's almost like we have these parallel tracks where modern medicine has not quite gotten a handle of how to deal with, or if they even want to deal with it. But patients are gravitating towards that, oftentimes paying out of their own pocket, seeking those cares because they feel they really help. They get the help that they're not getting in their 15-minute visit with their doctors. So how to bring that together, I think, is in many ways these two cultures. And against medicine is always like, what is the evidence? What is this? Whereas the traditionally complementary medicine has gone more with like this is age-old tradition that have worked. We know it works, and I have seen it in my patients, and they're not. So there's not two different viewpoints that they're going through. But as we're trying to say about how do we make this a little bit more mainstream, I think trying to get folks in the complementary medicine side of things to really maybe do some of the kind of studies that would validate that in the more traditional clinical realm. And and it's not there is some I think movement in that regard, and there is in the NIH there is a National Institute of Complementary Medicine where you can apply for grants to do those kinds of studies. But it's in general, it is not the kind of things that is done in the I think the complementary medicine field. And I think we just need more people who are able to bridge that divide, and actually, that is the way of, I think, just also getting the real dollars put into those practices by showing that they are efficacious in the kind of trials that we can do, and also really being able to provide that to a larger section of the population, and in some ways giving the more scientific validity that the healthcare settings require.
We need champions, and we need money for research.
Right.
Money, 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 and champions.
I think even more than money, I would say it's champions. I think the money is there. I think if you can, even as I say, even NIH has now a complementary medicine institute, so you can apply for it. It's, I think, people who are well versed in both worlds and are willing to go into, doing clinical trials is messy. It's not fun. It's, a lot of, grunt work involved. And it's not, as, rewarding, in many ways on a day-to-day basis as seeing patients and seeing, making an impact in their lives. But that's some of the, I think, more difficult work that needs to be done just so that we can, make this more, of a presence in our healthcare settings.
Okay, so I am timekeeper for this morning. We will have time for questions, but at this point we're going to transition to probably the most fun part of the morning. We're going to have John come and play a beautiful piece of music for us. So please enjoy.
Probably the most unconventional concert. Bear with me, but this piece is a very short piece, very short. It's a Chopin etude. It's Opus 25, number 1, and dedicated this to Rakesh, Marni, and all the caregivers here, and the ones who are here who've helped me along the way. So I hope you enjoy.
Thank you, John, for just a breathtaking presentation, both in your words and through your music. And I'm going to invite now Rakesh and Marni to come up front. We're going to have some Q&A time. While they're just getting quickly set up, I have to say we may have invoked the belly of the beast here at the Brigham. So I really am grateful for just the peacefulness and somehow now it's all quieted down. So it's interesting. I just wanted to acknowledge that there was something happening. Maybe it's the presentation. So just if you have questions, just invite you raise your hands. Marni, I wanted to just ask while people are getting situated. Did you offer any in the care, or how did you think about any of the herbal products? And was that offered as part of your treatment? You made mention of them, but I didn't know if that was something you had to think about, because the word adaptogen is it's a sort of a different word that is not often used in sort of the way we learn pharmacology. So maybe you could speak just a minute or two more about that.
Yeah, I in my training so far, I'm really focusing on diet and lifestyle. Although I'm learning the herbs and their properties and doing a little bit of experimenting, I haven't really brought them into my practice yet. And so that's something that I'll look forward to doing in the future. But, I do want to make sure that we're aware that integrative approach in this case was with medication. And so, some of the people I work with bipolar disorder are absolutely against all psychotropics, pharmaceutical approaches to bipolar disorder, but lithium actually is a naturally occurring element, and they're actually okay with taking lithium. And so it certainly isn't answering your question about the herbs, but that's one way to approach the use of lithium. But the herbs I will look forward to using more and more.
Okay. Suzanne? Yeah. And then we'll go up.
Thank you all very much for a fascinating and very successful approach. And John, I have a question for you. Sure. First of all, thank you so much for the Chopin. And secondly, my field is music therapy. So I'm particularly interested in the role of music. You mentioned that this was your passion, you identified it, you obviously acted on it. What role do you think that played in your recovery?
It played an incredibly big role. Since I am a pianist, it was right underneath my nose. It was always there. I think that's what helped me get through it for my childhood and high school and through college. And I believe it really not only is just for just listening and adding, soothing relief to your overall health, but it connects us with other people, especially in this room, I started that nonprofit because, I'm like, hey, I want to bring this feeling, this music to other people, and not just one person bedside with a guitar, which is wonderful, but I want a whole chamber music group. So at Mass General, we do concerts seasonally to do that, and we hope to bring more to that because it just helps people feel connected.
I think it's at the top there.
Yeah. I probably don't need a microphone.
But we're recording the presentation, so that's good. That's fine. Okay, that's fine.
Hi. So I guess I'm a practitioner in the field, and one of the things that I find hardest is I agree with all the things you're saying, but a lot of our clients or patients, that's not what they've come to see us for, or that's not what they're necessarily believing in. It feels like there's this maybe cultural thing, this medicalized model that's preventing people from trying to move forward in this way. So in a more practical sense, can you tell us like a tip to get somebody to sort of buy into it, if you will?
And just to clarify, when you say the it, can you just clarify? What do you mean by into it?
Eastern medicine, Ayurvedic practices, diet, exercise, meditation, mindfulness, all of that good stuff that is really important to progressing forward, but is sometimes something that people are not willing to do yet.
So I look at this in terms of readiness, and I try to take a motivational interviewing approach. So if someone is coming to see me for medication or psychotherapy, that's wonderful, right? And I actually believe in these tools. I slowly start introducing some of these other concepts. I don't call it Ayurveda. I don't necessarily call it mindfulness. But I naturally, organically bring it in as I feel that that person is ready to hear it and potentially internalize it and utilize it. So it really looks different for each person I work with. And what's really beautiful about having both the Ayurvedic modalities and all of the Western modalities is that I have such a wide toolkit at this point that depending on who's sitting with me, I can choose. I can pick and choose. I don't have to. It's not a one size fits all. I can take a little from this bucket and this bucket and this bucket. I could try different things, and then slowly, with experimentation, you see what resonates for each individual. And then from there, there's momentum that builds. And then they believe in that one practice, so I'll sneak in a new practice. And then they've got two practices, and slowly but surely, you sort of start to find that they buy in more and more. And then you can sort of, direct them to readings and literature and mindfulness classes and MBSR and the insight meditation centers and things like that. Slowly.
So I'm just thinking, Rakesh, on the sort of research side, have you been able to study any of the patient outcomes from your clinic or in any sort of structured way?
Not yet. So we have, again, we're taking our sort of baby steps, trying to even figure out how do we do this in the clinical care setting so I think this is where we want to build up on what we're doing clinically and seeing now what are the next steps, what seems feasible to do in a clinical setting, both in terms of providing care as well as thinking about what are the kind of studies we would need to do so we can replicate a similar kind of model, across different systems.
Okay. Randy.
I was curious, in your early presentation, you mentioned this is slow medicine. And I think much of a real full recovery from a psychiatric illness is slow medicine, whether it's Ayurvedic or traditional Western. And the thing that over the years has been, I think, somewhat tragically removed from American psychiatry is the notion of a context over time in which people can recover. We used to have months in a day hospital where people could return to a community or a psychiatric sangha and kind of get support from other patients and staff. And really, as you, I think, experienced when you went to India and you were at or Kripalu. So I'm curious as to what you've been able to do at McLean Hospital to develop a kind of integrative Ayurvedic long-term context, community for patients like John to return to on a daily basis or 2 or 3 times a week for months. You mentioned your tweets and your quarterly touch base, which I think is adaptive and it's useful in the modern world, but I don't think there's a substitute for people sitting in a room together. And I'm wondering how you could how you are doing it, think about doing it in the future, because I also think there's a great research comparative opportunity there for outcomes.
So we, just to paint the picture, so Rakesh and I started our wellness group at McLean about 3 years ago, and it was every other Monday. We had one patient. It was Rakesh, me, and this one dude. Most Mondays. Sometimes we'd get a couple of others come in, and we just kept showing up. And then we realized, so then we switched it to a different day of the week. We started meeting every week, and it followed an opportunity for the patients at the On-Track program to come in and have lunch together. And there's actually a new space in the On-Track program, the well space. So now the program has provided food, and once that happened, people started coming. And the group is now, I would say, a pretty solid group. We have about 8 to 12 people every week. They fist bump each other, they support each other, they play. We've gone out for mindful walks on the McLean campus. We've gone to the gym. We've done mindful eating exercises. It's a very playful group. We've had them bring in instruments. They've made songs together, lyrics together. So we're finding different ways to bring these, and it's actually all men right now. We're finding different ways to bring them to create a cohesive group experience. We talk very little about, sort of what happens in the room with our psychiatrist and therapist. It's like everything and that. So that's really been a really interesting experience. That if you create a culture, if you create the context, provide the food, the space, they play games with each other before and after the group. So it becomes an afternoon of togetherness for them, actually. And our group is just a part of that. We call each other by our first names. We have a very casual presence in the group. It's fun, it's creative, and it's different than anything I think they've experienced before.
I think we've had the luxury of sort of growing, being small. Like, when this started, the Entrepreneur, it was a one-man show. We had one psychiatrist, and that's how we started. And it's grown. And a part of the thing is, so we started with this one group that we had, which is the wellness groups. Now we've expanded that to multiple groups during the week. And not just only traditional sort of therapy-based groups, but one is sort of based more on cognitive remediation, sort of computer games and things that are in the guise of games, trying to get them, sort of address some of the cognitive issues. And we have a peer counselor who's now who's hired, who mans what we call this well space, which is a room dedicated just for the patient. We have art that the patients bring. There are lots of games. There's usually chess games going on between patients and the peer counselor. So we're still in this sort of trying to figure out what works and what doesn't work. And there's also this balance between trying to get the patients to come here, have that camaraderie and having that sangha, but at the same time, the emphasis is also on we don't want this to be your home, right? We want you to kind of get back on your feet and go on. So not, kind of give them the support, but not have them, become. So I said I always say, my goal in the Entrepreneur is to make sure that none of my patients become chronic patients. Like that's, the goal is to really trying to, support them in their early years as they're starting with the psychosis and the early stages of the illness, supporting them, but really trying to get them back on their feet. And I see the well space and stuff as really a place to try and nurture them while they're getting back on their feet.
One other comment about this, we've actually had John come in and share his story with the group. We've had another one of my longtime patients come in and share his recovery story, which has been tremendously powerful for everyone to hear. And now there's actually a peer specialist who is helping to co-run this program with us. And so we're bringing in real stories and real stories of success and inspiration into the group as well.
Okay, so I just wanted to, again, thank you, John, and thank you to our presenters for a wonderful presentation. So round of applause. And we want to continue this dialogue, so we would invite you to join us again across the hall. Just again, a quick next month, June 5th, Tuesday morning, Helene Langevin will be presenting. Here we have a research seminar grand round, so please join us again next month. And then on June 22nd to June 24th, we do have a conference looking at Ayurveda and its role in cancer and palliative care. Will be held at the Martin Conference Center. Details are outside as well. And then we have the network forum that is going to be held in the fall, and details are outside of that as well. So please register and attend these events. I think we're, again, looking to build our community, build inquiry, critical inquiry around these topics, and hopefully advance our medical care appropriately. So thank you again, and we look forward to seeing you next month.